The groundwork of happiness is good health. Saluatus, Lola Nko. Welcome to Moment with Lola. We have taken all obligations to raise awareness about certain health related issues, beauty and beautification, travel and tourism, fashion, and entertainment. My name is Orishada Redamola Dokas, two-time survivor of a brain tumor. On today's episode, I have, you can say I'm laughing, guys. Yes, I have a doctor in the building. Yes. So when I was down, I was recuperating. I came out in Nigeria. Before that, I checked his status, everything on Instagram. I'll be like, I like the work this man does, not knowing that, hey, that one day I'll surely meet him. Finally, I have Dr. DK here. There. Guys, I'm so excited. Good evening,
Good evening. Good
Doctor.
evening.
Merci beaucoup. Thank you. I called you.
Yeah.
Or should I say, we called you
Yes.
and you answered. Thank you very much. I'm
Thank you.
super excited, guys. Thank you very much for coming. I will leave the floor for Doctor to introduce himself first, guys. Okay.
So, how you doing, viewers? My name is Dr. DK Ebube DK, and the CEO of Heaven Clinic, the staff of Heaven Clinic. I don't call myself the CEO of Heaven Clinic. I'm actually, so I'm the staff of Heaven Clinic, and okay, actually, on a normal day, I don't go for interviews. Actually,
I
I
know
don't have
that.
that
I
time.
know that.
Yeah,
That's why I told you guys. I'm super excited that
you know. Okay.
I called him. I'm so happy. You guys will not understand the feeling.
But it was actually interesting because when my assistant showed me your message that you are a two-time survivor of
Brain
brain
tumor
tumor, I'm like,
air.
oh, okay, I'm interested. I want to get to meet this person, because a lot of people have such issues and then they don't
Yes.
come out from it. A lot of
Yes.
people go through it. I have a lot of patients who gone through the process, and then some of them have partial paralysis. Do you
Yes.
understand? So I have
Yes.
stroke after the
Yes.
whole surgery and all that.
Yes.
So when I was told that you wanted me to come for your show, I was interested. Like, okay, I want to get to meet this person and actually know what's actually moving this person. But actually, it's nice being here. So, like I said, my name is Dr. DK. I'm also known as Gifted Hands.
Oh yes,
Yeah.
gifted hands, guys. Yes,
So,
gifted hands. Oh, I'm super excited. Seriously, guys. Thank you very much. Thank you very, very, very
yeah.
much. So, I have a quick one to ask you, Doctor.
Okay.
We all know we have different aspects, different dimension when it comes to the medical
Yeah.
sector, right? So, why do you go for this particular? Why can't you go for neurologists or
Medical and all that.
other ones? Why?
Okay, so I don't like injection actually, and I don't like seeing blood. And
Ah,
then but basically, I actually did what they call process therapy.
okay.
In process therapy, where I study, you have a process where you have the wood therapy, the
Yeah.
acupuncture. There's a whole lot.
What do
There's
you
one,
mean by the wood therapy?
yeah, where you use wood for treatment. If you watch my page, you see where I'm using some wood.
Yes,
So
I saw
yeah,
some
there
there.
are ways the body communicates with the wood.
Okay.
So it's called actually it's called wood therapy.
Therapy,
So we have culture therapy. All around together, it's actually called the process therapy.
process
You
therapy.
understand? So
Okay.
and we have few people who actually practices process therapy in Africa, not just Nigeria. You understand? So
Okay.
I've had a whole lot of opportunity to actually practice outside the country, but because people say they don't like Nigeria, me I love my country. Yeah, so and I
Miss,
love it
I
here.
love my country.
Yeah,
Oh, I
so I
love
love
my
it here. So
country.
I prefer to practice here to help people and all that. So that's part of why I decided to actually go for that course. Some people call it physiotherapy, some call it different,
Physiotherapy.
but
Yeah.
in where I'm coming from, it's called process therapy.
Process
Yeah, in
therapy.
process therapy, that's where you have a pain management. That's where
Okay.
you have the wood therapy. That's where you have the culture therapy, the children instructors, the elderly people instructors. There are different programs on the
Wow.
process
Process
therapy.
therapy. Wow, wow, wow. Hey, me. It's just like I don't even know what to say again. Seriously, guys, because I'm not even in the medical system, but I understand. Let's say almost half of what he's saying. Yes, because I remember vividly. I also passed through therapy, speech therapy. I told you guys that after my surgery, I wasn't able to talk. Yes, and even to see perfectly. But give God the glory. I can talk now, guys, and I can see perfectly. So, doctor, thank you very much. Our next question is how challenging is your job? Because I can tell you that there's some jobs that you won't have time for yourself.
Ah, it's actually would I say it's challenging because that's what I used to say. If you see your work as a challenge, it becomes a challenge. If you see your work
Yeah,
as fun, it
fun,
becomes fun.
fun.
So even when people are seeing it that you're actually stressing, but to you, like I'm just doing what I love to do. So I'm here. I'm in Lagos during the week. I'm outside Lagos during weekends. I'm almost on the flight every weekend, and then to me that's not stress.
Wow.
Getting to like work with my patients, see them get better. I don't see
Yes.
there's no much. I don't really see any challenge in my work. You understand? And
Mm-hmm.
like I said, probably because I'm not personally seeing it as a challenge. I see my work like as fun, and I try to also
Yes.
make the patient to see the treatment as fun. So with
Fun.
that, it actually works perfectly for
Wow.
me. You know.
Wow. Hmm. That's nice. So you guys heard it from Doctor. Yes. So Doctor, what really makes you different from other doctors?
Ah, they ask me that question a whole lot. I don't even know
So
because
I'm not the only person that asks you
no.
that.
Because you see patient coming from India, coming from UK to Nigeria for me to attend to them, and you see people coming from different states to come to my clinic, and then people usually ask that question: what makes you different? I don't even know what makes me different. I'm just okay. Though me, I don't just see this as a job. I see it as a gift.
Yes.
Before I don't used to see it as a gift, but when I started leaving myself to look at myself, I say, oh, okay, this can actually be a gift, not just a job. You understand? So because I've
Yes.
accepted that,
Yes.
I don't really think anything about being special. I just do what I have to do.
To
I just make
do.
sure my patients gets better, and
Yeah.
I just don't like working under pressure, and it actually helps us a lot for me.
Wow.
So nothing special. The only thing special is the secret, and that secret is no secret.
That secret
It's
is
no
not
secret.
secret.
Yes.
Oh, okay. So doc,
Yes, please.
since you've been with on this your job,
Yeah.
making sure everyone gets better. So, like, what can you say about the Nigerian medical sector? Because I, as a living witness, I have a lot to say when it comes to Nigerian medical sector. I have a lot, but just thank God that
Yeah.
half of it is story now. You understand?
Yeah.
So, what
But
can you say about the medical sector?
there's something I used to say. No be my mouth. They go, yes. Water come on for coconut. But actually,
Ah,
it's not easy here
mhm.
practicing as a medical practitioner.
Practitioner.
Do you understand?
Yes.
It's not like we have an imbalanced medical system.
Yeah.
It's just that we don't have a balanced system.
Hmm.
Do you understand? We have good doctors here, like we have
Yes,
good
I can
doctors,
testify
but we
to
don't have a
that.
balanced system to
Yes.
actually assist them practice properly. Do you understand? I could remember working for some hospitals, and then I'm not allowed to actually practice the way you see me. I'm
Yes.
not allowed to do most of the things, the wood therapy thing, because it's not what people are used to. It's not what the hospital are used to, and all that. So, and then some hospitals are not after making people get better.
Yes,
They're just
I'm
after getting
hundred
money.
percent sure of
Yeah,
that because
yeah,
I'm a living witness. It's
yeah.
happened to me.
Yeah. They just want to get money. You
Yes,
understand? But
yes.
but so it's sometimes it's not even the government. Do
Mhm.
you understand? Sometimes
Mhm.
it's actually the people who have the money to set up these medical facilities. Do you understand?
Yeah.
Now, but I wouldn't say it's not the fault of the government. But like I said, the system is not balanced. We just have an imbalanced system.
But
But
when we talk about the system is
yeah,
not balanced,
yes,
automatically you're referring to the government.
yes.
So it's still the same because I can tell you, I remember 2020 when my case pop up.
Yeah.
I was to rush down to a neighbor hospital, one of the big hospital in Akwonjoye,
Yeah.
and that same hospital has been treating me for malaria and typhoid. Then my mom was just like, she was angry. She was like, this girl has been coming to this hospital more than years. The same thing. You understand? So on
Yes.
that fateful day, then I think the senior doctor was like, ah, emergency. So assuming it was not up to the case of emergency, I'm 100% sure they will give me tablet for
Yeah.
malaria and
Yeah.
typhoid again.
Yeah.
So that day they had to do a run MRI scan for the day. Like, this was going on with Amilola. That's why she's complaining of headache. And most people that know me from primary school till university, everybody knew Dami has one issue: headache. Headache. And when you go to the hospital, you are fine. Malaria, typhoid. So I was just like, "Ah, so could you say that still this is not government issue?"
Yes.
Like, my issue, but just like what I asked the senior doctor there was that, why did you guys ask me to do MRI since all these years
Yes.
or days? Why wait for it to be critical to the extent that I wasn't able to see? I was throwing up. Then now I say yes, MRI. Like, I will say it, and I will say it. Nigerian medical sector, I really don't know how to the adjective to use to qualify
We don't
it.
have a sector. We don't have a medical sector.
Hmm.
So if you understand what sector is, you know that we don't really have a sector.
Yes, I
We
think
only
I
have a
understand with my
system.
exact with
We
my case. I
yeah.
understand
We don't have a sector. We have a
perfectly
system.
system, and I
Yes.
don't think the system is working.
Yes, that's just that. So if you say a sector is something that is already modernized, but is not yet
Exactly
balanced. We
balanced.
don't have a sector, so
Voila.
there is nothing to balance there. We just
Hmm.
have a system, and then that same system, someone that doesn't know anything about health, or doesn't know anything about medical, comes into that particular seat, will not even know how to make it work. You
Yes.
understand? So that's
Yes.
why it's called just a system.
System.
But if it is a sector, there's amount of people who are
Like a
professionals.
body.
Yes, so their work is to make sure this sector actually produces what they are provided to
Provided
produce,
to
and then you
produce.
see it working. So, but when it's a system can crash, a system can be
Yes.
worked on, and other. So that's
Yes.
what we're actually managing in Nigeria.
Wow.
You know,
Thank you very much, doctor. So what do people misunderstand about you the most?
I'm very invisible, so
Yeah, you're very
you're
invisible.
very very invisible. Yeah.
Invisible like her, please.
Okay,
I
so
don't
when I
understand.
say I'm an invisible person, you know, when you're hearing about Dr. DK, when I enter here, I might not even know that it's Dr. DK that enters here till I
Mm,
go out. Do you
yes,
understand? So by
yes.
the time I'm done doing what I'm here for, by the time I'm out, someone is saying that's that Dr. DK. Do you understand? So people misunderstand it to be probably I have pride and all that, and I like it like that. Do you understand? Just give me my flower. I like it like that. So long as my patients are not saying I have pride, so long as
Yes,
individuals, so
yes.
long as my family are not saying I'm proud,
Yes,
do you
yes,
understand? So
yes.
it's better you're proud in the public to actually defend yourself than you are proud in what you do. Do you understand? That
Mm-hmm.
will not be good. But when people sees you, when you approach me, I talk to you, we have a chat, and
Yes.
then when I see you, I like what you do, I send you a message and tell you, oh, well done in what you do, God bless you, and all that. Do you understand? But when it has nothing to when there is no creativity in what you're doing, why should I see you and lie to you and tell you, oh, you're doing well? I cannot do it. Sorry, I cannot.
So you mean that you can't even be like, let me tell
No,
him
no,
or let me tell her
no,
so she
no.
will leave me or he will leave me alone?
No, no, no. Like I've worked with a lot of celebrities, and then some of them are musicians, and back in the days when they do new song, they send to me because I also did critics abroad. Like,
Okay,
so
yes, yes.
so when they send it to me, I also listen. Like, bros, this one no work. Oh. Do you understand? They'll be like, no, 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 just listen again. I'm like, I've already listened to it. This thing is not really working. Do you understand? Why don't you redo? And by then, the person must have mastered the whole songs and all that. So
Yes.
they don't like the fact that I'm a very blunt person. That's
Yes,
all.
yes, yes.
I'm a
Yeah.
very strict person.
Very strict. I can see that. Ah, I wish I too could be like you, be very strict. But my issue is always laughing. That's my issue,
That's why you're
doctor.
looking younger.
Ah, hey, doctor, take me on the look younger.
Yes. Smile has a way of making someone to look young. Yeah.
So, doctor, what makes you happy? Like, what makes you feel happy? May let's say at times you may be kind of down,
Nothing puts me down. Nothing.
nothing putting.
Yeah,
Yeah, always
I think
okay.
I've not been through worse. I've not. So see, like I told you, when you
Mm-hmm.
see things as challenging, it becomes a
Yeah,
challenge to
challenge
you.
to you.
Do you understand? So what I do is I create that fun environment for
Right.
everywhere I step into. Do you understand? So when I step into a place, I'm trying to foam up the place with happiness. Do you understand? And
Yes.
I'm not getting that vibe. I will just disappear because if I stay there one more time, I will just start becoming like them. Do you understand? So, but
Yes.
in my own, my own little way, when I come
In
to
your
where
own
people are
little
sad,
way.
do you understand? I make
Mm-hmm.
sure. So, if I make una happy that particular moment, if I come
Mm-hmm.
out, if una want be sad, make
Eh?
una continue. Do you understand my point? But I want to always see people smile. That's what makes
Smile.
me happy. And I've actually trained my staff to be like that.
Like
So if you are
that.
sad and you're
Doctor,
trying
can I
to,
be your staff
you're my
too?
staff already.
Ah, okay. So guys, hey, so call me Doctor
Yes,
Lola.
yes, of Heaven
For
Clinic.
voilà. Call me Doctor Lola. Maintenant, je suis docteur. Eh? Je suis docteur maintenant.
You know,
Thank you very much, doctor. So,
it's fine.
doctor, the last question I
Okay.
have.
Yes. Yeah, how you doing, people? My name is Dr. DK. You already know Dr. DK of Heaven Clinic, Gifted Hands. I'm just here to tell you, Moments with Lola is a very motivational show. You all really need to see this. We know say when they watch American programs, they watch other people's programs. Make you try, Just subscribe and make sure you stay and watch and finish. She's a 3-time survivor of brain tumor. You know what I mean? So she's actually doing this for us to feel motivated. If you're not motivated, maybe your own problem, pass our own problem. This is Moment with Lola. Peace.